Pacific Standard Time. We continue the conversation on Thursday, May 13th, and the following Tuesday, May 18th, each night at 4 p.m. and 7 p.m. Pacific Standard Time. Healing our land begins with the conversation.
Greetings and salutations from the sanctuary studio of the Faithful Central Bible Church. I am so honored to have you with us. My name is Bishop Kenneth Ulmer, and we welcome you from here, there, and everywhere as you're joining us for this very, 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 very critical topic. Let me just set the stage by saying I got mine. I got mine, you get yours. I got my vaccination, my wife got it, my children got it. But more than that, I come to you from the perspective of a church community and a civic community that has seen, in my estimation, too many funerals. I just got word in the last week or so that we've had 2 other members or relatives of members in our just one congregation, families that have been stricken by this dreaded, I call it a demonic disease. But I come to you with a heart that says, we can lick this thing, we can defeat this thing, we can make a difference. And I'm so honored to have with me 2 very distinguished guests. They've taken time out of their busy schedules. They are literally on the front line. Thank you so much for coming, Dr. Jerry Abraham, who cares for patients in South Los Angeles on our side of town at the Kedron Health Center, historically black institution. And Dr. Abraham serves as the director of the Kedron Vaccines program, where he and his team have vaccinated over 2,500 people per day, and to date have vaccinated over 50,000 people. 50, that's more than my hometown. But they have done a tremendous job here in LA. And then the gifted, the honorable, the beautiful Lady of God, Lady of Medicine, Lady of the Stethoscope, I'm gonna call her, Dr. Rhea Boyd, who is a pediatrician. And I'm especially glad to have Dr. Boyd with us from her specialty of being a pediatrician, because I have gotten all kinds of questions as to how does this thing relate to children. She's a public health advocate and scholar who writes and teaches on the relationship between structural racism, inequity, and health. She and I ought to do a book together. But she has been gifted and given favor to address these issues. She serves as the Chief Medical Officer at San Diego 211 and the Director of Equity and Justice for the California Children's Trust. And now I think she's up in the Bay Area. She just gets all over the place. But we are honored to have them, Dr. Boyd and Dr. Abraham. Thank you for coming. Welcome. Look,
thank you for having me.
Thank you. Dr. Boyd, welcome aboard, my brother.
Thank you, Doctor. Thank you.
Dr. Abraham, thank you so much. Look, listen, let's just jump right into this thing. Let me give a broad stroke. Here's the big question. How long, Lord? How long? When or do you think this issue, this virus, will ever be completely gone? Are we talking about ending this thing? Are we talking about controlling it? Is it something that's going to be like polio that's in history, or is it something that's going to be recurring, like maybe getting a flu vaccine? What do you think? What is the prophetic utterance that you guys can give us about where we're going with this issue? Dr. Abraham?
Sure. Thank you so much for having me, Pastor. Dr. Abraham here, Director of Kedron Vaccines. We have now vaccinated over 210,000 people here in South Los Angeles. We're so proud of all the people that have come together, including everyone who's rolled up their sleeves and gotten their shot, including you, Pastor. And we congratulate you and we thank you for playing your part. In addition to wearing your masks, washing your hands, socially distancing, we all need to, when the time comes and a vaccine's offered to you and there's no medical contraindication, we really hope that you take your shot and then you go on and you get activated and you help get your household, your community, your church vaccinated. So we're excited to be here today with you on this town hall. Really important question. We don't know all the answers. That's where we will start. We know our history. We know the medicalization of racism in this country, the undertreatment of pain, the Tuskegee trials, the abuse of Henrietta Lacks cells. When we look at all the things that have happened to our communities in this country and around the world, we understand that we need answers and we need truth, and we will give it to you, and we will give it to you straight. And so the truth is, we don't know for sure. But our goal, our hope, our prayer is that we end this pandemic. And the key to doing that is not only creating good medicines that treat you when you get disease, not only is it all the countermeasures that we're doing in society to keep us safe, but it's also developing these vaccines that prevent disease. And when we do all those things right, we'll really achieve that herd immunity. And that means that there really will be nowhere else for that virus to go. And that's how that virus goes away forever. And that is our hope and prayer. And that's what we did in the 60s with smallpox. That's what we do with polio, even though there are parts of the world still with polio. That's what we try to do with all of these infectious diseases that truly are preventable. We're on a mission, just like we're on a mission with HIV, and we know one day we'll get there to end that epidemic. We're on a mission to vaccinate as many people as possible, to treat people and make sure that we survive this and end this pandemic so we can get back to life, get back to church, back to school, back to work, back to loving one another and hugging and kissing on grandma as we once and always did and want to do. Happy Mother's Day to everyone that's out there as well, to all the mothers and grandmas and everyone expecting. And absolutely, yes, this vaccine's for everyone, including pregnant mamas and breastfeeding mamas. And so we're here to answer all your questions. We'll be available. But the truth is, we don't have a certain answer for that. That is the goal. The more of us that get vaccinated, come June 15th, we'll open up the state of California for business with Governor Newsom, and we're proud of that. We need to be able to go back and do the things we once did. We look forward to our partnership with President Biden and Vice President Harris as they look to get 70% of adults vaccinated by July 4th. We believe when we do all those things, not only that, we have to look to our neighbors, to the north, to the south, to the east, to the west. Make sure that people in Mexico get vaccinated, people in sub-Saharan Africa, people in India get access to vaccines. When we all get those vaccines, we will get very close to ending this pandemic. That is our hope. That is our prayer.
All right,
Thank
you must have some preacher in you, because you just preached it all, and we can go home and go to dinner or whatever. I'm gonna come back to you in a minute. Now, yesterday, Dr. Boyd, yesterday was Mother's Day, okay? And today, I believe it was Pfizer who just got approval on teenage, 13 or 16, whatever it is. Okay, from your pediatric experience, from your position as those of us who all celebrated Mother's Day yesterday, what can you say to mothers about how their children, their youth, their babies should be dealt with regarding this vaccine?
Yes. Well, thank you again for having me. I'm so excited to answer everyone's questions today. And that's a really important one. So as you said, Pfizer now has emergency use authorization for kids aged 12 to 15, which means down to age 12, kids will now become eligible to receive at least the Pfizer COVID vaccine. What that means is parents, mothers, caregivers, guardians, grandparents now have to consider if they are going to vaccinate their children. And the data that we have to help you make that choice is the data that came from Pfizer's phase 3 trial. So every medicine, including the COVID vaccines, have to go through a period of trials, phase 1, 2, and 3, to make sure at first that it's safe, 2, that it's effective, that it works, and 3, that it's more effective than anything else we have on the market. And so what we saw from the phase 3 trials for kids aged 12 to 15 is that there was 100% efficacy, actually, even better than adult trials the Pfizer vaccine performed in kids aged 12 to 15, and that they showed similar immune responses, similar boosts of their antibodies to having gotten the Pfizer vaccine. We didn't see any concerns for major safety events. Children aged 12 to 15 had similar side effects as adults, things like pain at your injection site, muscle aches, fever, fatigue, headache, chills. And those side effects tend to last a couple of days in children, just like they tended to last in adults, and they're easily treatable by over-the-counter pain medications like Tylenol or ibuprofen. So for parents who are now thinking about vaccinating their kids, especially parents that aren't vaccinated yet, which means your household doesn't have the protection of you being vaccinated, now is the time for you to get vaccinated as a family. So when it's time to get your kids vaccinated, come, bring grandma if she's not vaccinated, bring grandpa, bring your neighbors. Go as families to get vaccinated once kids become eligible.
You touched on something, and I want to expand it, and then we'll go back to Dr. Abraham, because here's what I hear all the time. Here's what I hear probably the most common, not even complaint, but most common observation. Help us to understand the testing process. Number one, everybody's saying, wow, this happened overnight, this happened too fast, this happened too quickly. How was the testing done? And here was one, were we included? So give us some insight, both you guys, about the testing process, the length of time, what is the curve? Are we ahead of the curve? Have we broken? Were any rules broken? And just help us to deal with the idea of this thing came mighty fast. Dr. Boyd?
This is a really common concern we hear from Black communities across the country, that this happened really fast. It's important for people to understand that the mRNA vaccines, so that's the Pfizer and the Moderna vaccines, that technology was not brand new. It had actually existed for more than a decade, and it was just sitting on the shelf at NIH, our National Health Institute. And so we were able to use that technology during this moment of crisis to then accelerate the production of a vaccine for COVID. So it's really important that people understand that wasn't novel technology, we already had it. The second point to understand is that because this pandemic was so deadly, because it has been so devastating to all of us, our nation poured more resources into the development of this vaccine than any other. That then created unprecedented collaboration between companies that typically compete with each other. They are now working together to 24/7 produce COVID vaccines because it was that serious and the pandemic was that critical. So that's part of how this moved so fast. But people should understand that that doesn't mean any safety steps were skipped. For any medication or treatment or procedure to receive FDA approval, it has to go through trials. And those trials ask the very questions that most people have. The number one question is this safe? And that happens in a phase 1 trial. So before you even get to the third phase of your trial, we already understand that there are not serious side effects. Phase 2 then tries to titrate the dose to determine how much should people receive and is that dose effective? Does it work? And then phase 3 says, now that we know that it's safe, now that we know that it's effective, now we're going to test it in more people to see if those things still hold true. And so for the COVID vaccines, the phase 3 trials included tens of thousands of people, between 30 and 40,000 people. And now that more than 100 million people have received at least the mRNA vaccines and tens of millions of people have received the Johnson & Johnson vaccines, we also have the benefit of that safety data that tells us for the mRNA vaccines that there have not been serious side effects aside from a very rare incidence of allergic reactions that every patient is observed for after you receive a vaccine. And that for the Johnson & Johnson vaccines, and we can get into this later because I know people will have questions about those side effects, that when we saw a safety signal that 6 patients out of the then 7 million had those dangerous blood clots, we stopped the whole process. And that's really how closely we are watching to make sure that we know that these vaccines are safe, they remain safe, and that they're incredibly effective at preventing severe COVID infection and, most importantly, preventing COVID deaths.
Dr. Abraham, chime in on the idea of, well, first of all, help us to understand a little about the team. I understand there was a gifted a sister who was on that team, who was at the front of that team. But give us an idea about how that works, and then comment on the let's get this out in the open, on the J&J faux pas, whatever. I understand Dr. Boyd just said something, 6 or 7 out of millions. Explain that to us, because that sounds like I got better odds on the lottery. But kind of give us put that in perspective. First of all, the J&J issue, and then the numbers that came out of that and how we should move forward. Dr. Abraham?
Yeah, let me also just pick up where Dr. Boyd left off. That's really important, all the information Dr. Boyd put there. And I'll add, there were Black people, Latinx people in the clinical trials. There are people that I personally know who purposefully volunteered to be a part of the trial so that that very concern would be addressed. And then on top of that, there were independent reviews going on to make sure that we were watching our NIH and the FDA and everything that's happening, including the NMA, our nationally historic Black medical society in this country, had a group of experts watch closely, including one of my very close colleagues, Dr. Oliver Brooks. And so just really want people to know that we would never offer a dose of medicine if we did not believe it would help improve lives, save lives, and that's what we do here at Kedron. This historically Black institution, started by 22 Black psychiatrists in 1965 during the Watts riots, when Black and brown people had nowhere else to go. That's that same place, that trusted healthcare partner that today offers everyone their vaccine. It's ingrained in our DNA. It is who we are, our genes to help, and that is exactly what we're doing with our vaccine program. So roll up your sleeves, get your shot, get your questions answered tonight so that you go with God and that we do help end this pandemic. But to your point, Johnson & Johnson was a setback. It was a very frustrating situation. But to what Dr. Boyd said, you know, when we look at 6 or 7 cases initially, when they went and combed through that data, if you saw that video that was playing before we actually started, they talked about that VAERS system, that vaccine adverse events reporting system that we all use and report side effects. When they saw those 6, 7 cases, I applaud our country, I applaud our FDA, our CDC for saying, let us pause, let us watch, let us see what is going so no one gets harmed. We put people first, patient safety first, vaccine safety first. And so we paused a program that had vaccinated over 7 million people by that point, because we wanted to make sure we understood what happened to these 6 individuals, women between the ages of 18 to 44, who had these clots, this cerebral sinus venous thrombus that needed to be treated and managed a certain way. And then once they did that with their fine-tooth comb, they looked through all the data and they identified all the cases. They did their deliberations and they came back and they said, unlock your refrigerator, Dr. Abraham, you can use that Johnson & Johnson again. Even during that pause, we had people show up and upset they couldn't get their Johnson & Johnson. And that very Friday when they said, go and use that Johnson again, we had people lined up, and we've been using it every day ever since. It's a great vaccine, especially for those that are hard to find for a second dose. We have people living in homelessness encampments. We have people living on the street. They may be hard to find. They're jail populations. They may be hard to find in 21 days, 24 days, 28 days. There are people that are homebound, frail, elderly, who'll never leave their home, need a vaccine too, but may be hard to get back to for a second dose. It's a great solution. I'll be honest with you. I look you straight in the camera tonight and I tell you, any which vaccine was given to me, Moderna, Pfizer, or Johnson & Johnson, I'd roll up my sleeves and take it if I did not have a vaccine. And I'll tell you why. Because every one of these vaccines prevents death attributable to COVID-19 infection. Every one severely reduces ICU admissions, critical care admissions. Who wants a tube down their throat? I don't. I don't think our people want it either. We look at hospitalization rates. So just like the flu, I get patients who come at me and tell me, I got the flu shot, doc, and I got sick still, and this, that, and the other. I say, well, did you get pneumonia? Well, you're here to tell me the story, so it clearly didn't kill you. So what it does is it lessens severity. So these are very good medicines. They prevent death, which is what we really want. We want equity when it comes to survivability. We should survive COVID just as much as rich people, just as other skin people, just as people from other parts of this county.
All right, Doc, slow your roll. I want to come at it a little different way, and I want to come personally, okay? And I want to start with Dr. Boyd and then pass on to Dr. Abraham. Help me on this one, okay? I got my vaccine, you know, my wife got it, my family, my kids got it, and it seemed as though within days after I got mine, and I'm going around showing my arm and everything, and my little patch, and I got it. But then I'm hearing about all these variants and variations, and some from the UK and some from South Africa. I have two very dear friends who are from India. And both of them have had family members and friends who are just being devastated. I mean, we all know what the news is saying. Here's my question. I was rolling pretty well until I'm hearing, here come all of these variants. So you guys help me understand. I got mine. I know we just talked about the vaccines and all that, and Pfizer and Merck and all the ones that we have. That's good. But now here come all these variants, and y'all wasn't talking about them when I got my shot. So how does the vaccine that I've already had relate to the variants that are coming up from every nation, all over the place, okay? Dr. Boyd, what should be our mindset about getting a shot now, and yet there seems to be a variation and a variation and a variation? What do you think?
This is a really important question. So first, just to give people some baseline knowledge, it's important to understand that all viruses change over time. They all produce variants. It's because when they move from person to person and they try to replicate themselves or copy themselves, they make mistakes. Most times the mistakes that they make in trying to copy themselves are not helpful to the virus, and it makes the virus die out of the population. But sometimes those mistakes that they make actually make it more robust. It can make it more transmissible, meaning it's easier for you to catch it. And sometimes those variants can also make it more deadly. And so we are really worried about variants that are emerging around the world. The single most effective way to decrease the spread of variants is to increase the rates of vaccination we have in our population. Because the more people that are protected from contracting COVID, the less opportunities the virus has to then infect you and make those tiny changes. And so it's really important that we vaccinate our population here in the United States so that we can decrease the emergence of new variants, and that we as a nation who is incredibly wealthy, that we share the vaccination resources that we have with the world, particularly with areas like India and Brazil, because this is a global pandemic and the variants that are there can come here over time. What we know right now is that the vaccinations that we have, Pfizer, Moderna, and Johnson & Johnson, all of the three that are approved in the United States, currently are effective against all of the variants that currently circulate in the United States. Now, if we don't get the pandemic under control in other countries, the concern is that the variants that are there that our vaccines might not be well primed for will come here. So this is why Dr. Abraham and I have been working very hard to make sure our communities understand it's important to get vaccinated right now so that we can slow the spread of the pandemic here and eventually achieve global COVID control.
Dr. Abraham, I'm in two global international clergy coalitions, okay? And I've talked to some of my friends who have mentioned something that Dr. Boyd just said, and that is some of these guys and women are from third world countries, and they're saying, I hope we can get them. They're implying America and Canada are hoarding it, you know. So two questions. First of all, might I, having had a vaccine, number one, might I need to take another vaccine in light of the variants? And then number two, in terms of what Dr. Boyd said, what is it looking like around the world and in terms of America's both utilizing what we have and helping other countries? What do you think?
Yeah, thank you so much. I really just applaud what Dr. Boyd said. You know, we have to help everyone. We have to put on our own oxygen mask, and then we have to look to our neighbors and help them get theirs on too. And we can't be selfish. Now is not the time for that. And so I really hope and pray, and we all need to come together on this one. It's essential. And as Dr. Boyd mentions, just like we do our best to end disease, viruses do their best to stay alive and survive. So they're mutating, and we'll continue to tweak and evolve our technologies so that we are best protected. And that's what Moderna has done with their newest, latest iteration of their vaccine. So that is newer and more improved. One thing that I love talking to people about Johnson & Johnson is that it actually was developed during the time of the UK variant. Moderna and Pfizer originally were developed during the summer of 2020. So we didn't really have that UK B117 variant or these variants here in LA, the Brazil variant, the India Indian variant. And so we're looking at that closely. Of course, this double variant that we have seen in India and UK, we're very concerned about. And of course, that's exactly why we need to make sure that if we get to a point where there is so much antigenic drift that these vaccines are no longer effective, we will create newer versions that are. And we have done that with the flu shot. We have done this with many vaccines in the past. And then we really do need to come together to make sure that other countries get access to them. Canada actually does not have a lot of vaccines. So we're trying to look, I'm literally talking to the State Department, to the Biden-Harris administration on how we can do more to get vaccines into Mexico and Canada. And of course, the devastation we see in India, it's coming. People are traveling, people are on planes. You know, disease sees no borders or boundaries. And it's a shame that we as people we fail to recognize that we really are all in this together. And these are our brothers and sisters, and they need help just as much as we need help. So I really do pray we get vaccinated, but we need to make sure that we also then turn to our neighbors and help get them vaccinated. We got to send these vaccines abroad, and we'll continue to monitor the situation. As Dr. Boyd mentioned, if they're not effective, you better believe neither of us are going to offer them to people, and we're going to demand that the manufacturers make vaccines that protect us and are safe, and if they're not doing that, we'll hold them accountable to it.
Let me just take a pause for the cause. Let me say to those of you who are watching us, thank you so much for tuning in. This is such a critical conversation. Listen, if you have any questions, put it in the chat. We'll do our best to get to as many as we can. I got enough to last from now on. I got a bunch of them. But we want to address as many concerns as you have. So if you're watching, if you have a question, put it in the chat. We'll do our best to get on as many as we can. We've got a team that's going to help you with that. And so our concern is, and all of you are get understanding. And so we're here to provide information and understanding. Dr. Abraham, one more time. Listen, how should we be concerned in terms of this getting these vaccines and how they might react or how they might influence those of us who are taking other medications? Is there any research? Is there any? Have you been able to track the fellowship between these vaccines and other medications that people might be taking?
Yeah, first I just want to say, Minister, I really am so proud of being a part of this town hall, and your questions and the way that we're doing this and coming together and sharing this information. It's just amazing. The questions you're asking are so spot on in this format, and getting your congregation to hear this. And so I applaud you in asking them to bring their questions forward too. This is amazing. It takes a lot of courage. Thank you for publicly sharing your experience with this vaccine and for bringing this to everyone that you minister to and help. So really have to thank you, because your questions are all spot on, and I'm impressed. You have done your homework. So to answer this question, you know, this vaccine really is very important for people that are older, which is why 65 and older got, prioritized early on. You saw what we did in nursing homes and made sure they got them, but also for people with underlying medical conditions. It's essential that they get it because they are more susceptible and vulnerable to infections and disease. And so COVID infection, while may not strike everyone the same way, we can spread it. But then unfortunately, when grandma gets it or those with a lot of other conditions get it, they become more serious. So as far as contraindications or as far as other medications that are involved, we talk about polypharmacy. That's that word that we use in clinics and hospitals when we're taking too many medications. We have not seen recommendations that certain medications not get it. What we have seen are those that were treated with certain medications when they had COVID, what we call these monoclonal antibodies, there were recommendations on that. So for patients who are treated for COVID with special new medications, we still ask, please do talk to your doctor. If you are a cancer patient, if you are a patient who sees a rheumatologist or an allergist, you get special injections, newer medications, we always say, please have those conversations with your individual care team that understands everything going on with you and your body. Everyone is different. Every vaccine will respond differently in everyone. While we see the numbers for Pfizer and Moderna are very, very high, highly efficacious after that second dose, 94, 95%, and with Johnson & Johnson in the 70s after that one and done shot, that doesn't mean everybody gets the same protection. Some people's machinery just doesn't work the same way. That may be because they're older, that may be because they have underlying medical conditions, that their body just is not able to produce the infantry, that cavalry that you need, so when coronavirus comes for you, you can destroy it and squash it. So that's especially why for certain groups, we're going to see this very soon. You heard Pfizer, you heard Moderna say it. Third doses are coming, and they're coming really for those that are more vulnerable, maybe more senior, and those with medical conditions first. So we really want to make sure that they mount the proper response so that they don't get sick, that they don't get susceptible. And we know this when we do this. We do this with hepatitis B vaccine. We've seen it with the HPV vaccine. It was a 3 series, now it's a 2 series. So vaccines are always evolving based on the evidence we have, the science we have as the technology improves. But really, people with other medications, because they have underlying medical conditions, diabetes, hypertension, heart disease, kidney disease, taking mental health medications, I have treated every one of those types of patients with this COVID-19 vaccine, and none of those are contraindications. In fact, you're a group that's prioritized and should stand first in line to get your shot. It's like going to LAX and getting in boarding group 1. This is your shot. You get on board first.
Okay, I want to go to the deep end of the pool, and they probably won't have me back anymore to host these things because I want to go to a very, very serious issue here. And I'll personalize it as much as I can, and yet I'll be anonymous. Here it is. I have some medical friends. I have some doctor friends who told me to my face, I cannot go on a camera, I cannot go public and say, wait and don't take this vaccine yet. But I have more than 2 or 3 gathered in his name. I have several doctor friends who are saying, no, not yet. It's too early. It took too long. It took too fast. The test was too fast. That's one group. The other group is I have some personal doctor friends who shall remain nameless who say they're into the vitamin ministry, the vitamin ministry. ZCD, ABC, and so there's this medical position. That's where I want to go. There is a medical position that, number one, says there are vitamins that you can combine that'll prevent this thing. Number one. Number two, there are obviously members of you guys have colleagues who are saying, slow your roll. Not yet. It's too early. Let's wait and see. You're on here now, so can you, what saith thee? What do you think? What do you think? Because people in our congregation and people in our community are hearing that.
And we're hearing it from them. About a third of Black folks across the country have said that they want to wait and see about the COVID vaccines. That's data from the Kaiser Family Foundation. So we know that people have been waiting to see. I think the first thing to say is the wait is over. If you were waiting for a third of the population, like more than 45% of U.S. adults have had at least one COVID vaccine. That's almost half of folks.
Good.
And among those who are vaccinated, only a quarter of Black folks have received one. We are the least vaccinated population. We have waited the longest. And because we've waited the longest, and because some of us live in areas where we don't have good access to the COVID vaccines, we are now the least vaccinated. So it's important that people understand while waiting early on to get all the data, to have it come in so that you can make an informed choice was really important. We now have data on almost half of the U.S. population. This is more data on a vaccine than we have for nearly any other vaccine in the history of vaccines. That's how enormous the safety protocols have been around these vaccines. So people have waited, and now is the time to get vaccinated because we're trying to outrun the variants. We're trying to control the pandemic enough that we can safely reopen the state, come June 15th, and that we can hopefully gather in person like the Biden administration would like us to do come July 4th. So it's important that people understand that we have waited, and that now that half of Americans have been exposed to these vaccines, we have enough data to conclusively say they are absolutely safe, they are incredibly effective, and it's important to get them. I'll also say I think your second part of your question was, in addition to waiting, remind me the second part. You said doctors are also saying
the vitamins, Z,
the
C,
vitamins.
D. Yeah.
I hear this all the time. People hit me on Twitter and they say, Dr. Boyd, I heard vitamin D will cure COVID. I just want to be the first person to say that if vitamin D would cure COVID, there wouldn't be vitamin D on any shelf in any grocery store or pharmacy anywhere. We would be pushing it on the streets. There is no cure for COVID. And while it's important to take multivitamins for your general health at baseline, unfortunately, those multivitamins do not give you any additional protection from contracting COVID, from being hospitalized with COVID, or from dying from COVID. The only tool, and this is just the honest truth, the only tool we have internationally to fight this pandemic is the COVID vaccine. A good example of that is what's happening in India. As we see their COVID rates, right? In India, they've had 300,000 people or more have new COVID cases every day. They are having the highest rate of COVID deaths of any other country right now. And what's the number one thing that they want in addition to oxygen? COVID vaccines. They want the vaccine because it's the only shot any country has at narrowing the rate of rise of COVID, at closing and containing the pandemic. So it's important for people to understand vitamins just aren't that. Nobody from India has asked for extra access to vitamins. What they want is the vaccine, because the vaccine saves lives.
Dr. Abraham? You're muted.
How about now? Can you hear me now?
There you go. The devil is a lie. There you go. Yeah.
I told you there's a devil, and they are alive, and they are trying to attack us in our community. And I'll tell you, some of these lies are just really fascinating. What I saw was less than 1 to 3% Black and brown healthcare worker vaccine hesitancy in the earliest days. You better believe I picked up the phone Christmas Eve and demanded, where are our vaccines, to the County Department of Public Health. And you better believe I had lines wrapped around with Black and brown healthcare workers who couldn't find a shot anywhere else. They came. Do you think all those doctors and nurses, all those Black and brown doctors and nurses would do that if it wasn't a life-saving shot? Now, I'm not saying there are not people out there who believe we should, and I might myself included, I'm sure this is true of Dr. Boyd, we should do our part. Sleep well, eat well, move, all those things we're supposed to do. And if you want to take your supplements because you believe that added vitamin C and zinc and vitamin D, we know some of those things help our immune system. We're optimizing. It's like when you go to the gas station, you choose to get the expensive Supreme. You know, you're getting some of that little tanked up. Sure. But that ain't going to be gas alone, right? You're going to need the real medicine. And so it's very important that you do get those vaccines. But it's still absolutely, I encourage you all, everybody should sleep and eat well and move, and that'll all help us be healthier, period, even when we get COVID. But it doesn't change the fact what Dr. Boyd said is absolutely right. We still are susceptible. We still can get it. We still can die. Why take that risk? I know people that died. I know people that got severely ill from COVID. Why? When you know if this did that, we would not approve this vaccine, right? So you're really not really comparing apples to apples or apples to oranges. We know that one kills and one saves. So that choice is pretty obvious. And the demons I speak of, that misinformation, that false news, there are people out there to tell us this is not our vaccine. Government program, putting a chip in you, the mark of the beast, going to turn you into a reptile. Where this information comes from, I don't know, but I'm going to tell you now, we shouldn't fall for it. They purposefully want us to fall for it so that we don't get saved. If this medicine didn't work, why did all these rich people get it? Why did people from other neighborhoods get it? Why did all of our healthcare workers get it? And I know that sounds crazy to say, but that's true. Why did I get it? Why did Dr. Boyd get it? Why did you get it, Minister? We got it because it saves lives. It is the best defense we have at ending this pandemic, to get back to those missed moments, to get back to worshiping collectively like we once did, singing in choirs. When you think about all those things we missed in 2020 and the last 12 months, we want them back desperately. Our kids are being robbed of their childhood because of this pandemic. The best thing we can do is play our part. Wash your hands, wear a mask, socially distance. But when it's your chance, when you're offered that dose, you roll up your sleeves and you take that shot.
All right. Good Reverend, Dr. Abraham, thank you so much. Look, have a great question from one of our viewers. A great question I want to share with you. By the way, you mentioned those three things: sleep, eat, and move. I got 2 out of 3. I ain't gonna tell you which one I ain't got, but anyway, but I'm with you. I'm feeling you, man. I'm feeling you. Listen, here's a great question from a viewer. He or she, doesn't say which one, they got the vaccine, the first vaccine, in November of 2020. And then with all of the shifting things with Pfizer and all that, they were reluctant to get the second dose, and kind of ambivalent back and forth. Their question is, are they protected enough, number one, now to not get the second dose? Is it too late? They got the first one in November of 2020. So I've never heard that question before. So they're saying, am I over the limit? Am I covered if I don't get it? What's your, Dr. Boyd, we'll go with you first. What's your advice to this person who got it in November and has not yet gotten the second dose? What do you think?
First, double check your COVID vaccine card. So the first vaccine wasn't approved till December 11th. So you got it sometime after December. So double check the date. Then it is important to get that second dose because it gives you the maximum protection. So 1 dose of Pfizer or Moderna gives you about 80% protection, but 2 doses gives you 94 to 95%, which is much more effective. So if you're able, get that second dose. Although we prefer for people to go within 21 days for Pfizer or 28 days for Moderna, it still is okay to go now. So if you're unsure, sign up and you can still get your second dose. And it is important because it will give you the maximum level of protection that you can have from having this vaccine.
Dr. Abraham, here's one. My son-in-law had COVID, did get sick, praise the Lord, got healed, and is doing well. My question for him, and maybe for others who may have had it and recovered from it, should they get the vaccine? Should they get both vaccines? Does it matter if they get 1 or 2? If they've already had it and, praise the Lord, they recovered, what is the prognosis? What is the advice for those who have had it and still have not had, or should they get the vaccine?
Sure, absolutely. And I'll just add to what Dr. Boyd just mentioned. Of course, the emergency use authorization for Pfizer was 17 to 21 days. The CDC says up to 6 weeks. We know in the UK they were doing up to 3 months. But the truth is, whenever you show up for your second dose, and we hope it's sooner rather than later, we will give it to you. We will not restart the series for Moderna. That is days 24 to 28, but up to 6 weeks according to CDC. 3 months we've seen around the world, but anytime you show up outside of that window, we will give you your second dose. That way you don't have to start the series over in Johnson. You're one and done. Now, as far as immunity and protection from disease, first and foremost, praise God that this person that asked the question, that their relative is alive and well and hopefully safe, and that's really important. We're seeing those, one, there's the devastation of the disease itself, the acute situation in the ICU. We're also seeing that we call it morbidity in medicine, but that long-lasting implications, those long-lasting effects, that long hauler story, they're not smelling, or they're having the fuzzy memory, or they're having every now and then some neurological or muscle. So we know there's some long-term impacts. When I talk about this, fear of the vaccine versus I'm more scared of these long-term effects and of active acute COVID disease. And it's not pick your, which one are you more afraid of? But it's just when you look at what is happening, there are people suffering the consequences of having gotten COVID. Thankfully, those that got COVID will have some protection in that immediate window. We don't know how long that window is. We've got numbers that say 3 months. There are some that say up to 6 months and maybe even beyond. But the truth is, the recommendation is after those 10 to 14 days that you had COVID, ideally after you've tested negative, as we've done here in Kedron, here in South LA, the 210,000 plus doses in arms, many of whom had COVID, that is the recommendation, that you get it for that added protection, because your immunity will wane and wear off. And unfortunately, your immunity may not be as effective as the immunity provided from a vaccine that may be more strategic for the variants and mutations and various strains that exist out there. So if it were me, I for sure, COVID or no COVID infection, and I was eligible, I would roll up my sleeves, get that shot. And then as Dr. Boyd mentioned, as Minister Kenneth mentioned, then you go and get activated and you go help your household, your church, your workplace, your school get vaccinated too. Because when we're all collectively vaccinated, that virus has nowhere to go and no one to infect.
Here's another question. I want to piggyback on what you just said. And I hear this a lot, Dr. Boyd, a lot. What kinds of information does the medical profession have for down the road, long term? As Dr. Abraham just said, I know people who have had it, gotten better, and they still can't smell. Okay, I know people who've had it, gotten better, and they still kind of feel, in terms of side effects. But where are we with prognosis? Where are we with looking down the road as to the long-term effects of taking the shots? Do we know?
It's a great question. I mean, the truth is, because these vaccines were first used in mass just over the last, 6 to 8 months, we are now just collecting data about what the long-term effects are. There's evidence to show that the immunity seems to last, the antibody response at least, seems to last at least 6 months after having a COVID vaccine. And we have that evidence from healthcare workers who are vaccinated the earliest in our country. We have suggestions that even as your antibody response, that specific fighter response to the COVID vaccine, may go down after 6 months, that you still have immune memory, which means your body can then remake that response if it ever faces COVID and you're exposed in the community. So it appears that people have, as Dr. Abraham was saying, prolonged levels of immunity in response to the vaccine in a way that you do not have from actually getting COVID infection. That immunity seems to be shorter lived than the immunity you get from the vaccine. So far, what we've seen is that long term, and we've only been able to say over how long we've been giving the vaccines out, that immunity persists and that you have prolonged protection and that there are not prolonged or future side effects, which, as Dr. Abraham was comparing, is very different than what happens if you actually get COVID, as we've seen some people have prolonged symptoms that do not seem to resolve. Particularly for long haulers, there has been some early data to suggest that getting COVID vaccines may actually help your symptoms to resolve sooner. So it's important, even if you've had COVID infection, to get the vaccine so that you have a more robust and a more long-lasting immune response. And if your symptoms are kind of languishing on in long COVID, that the vaccine may actually help those symptoms start to wane off and end.
Let me tell you guys, I really appreciate you guys shooting straight with us. I'm serious. And I've been in this is about my 4th or 5th dialogue like this. And I've been in some of these dialogues where they were tossing little softball questions and planned answers and everything, and then where they started sidestepping and doing the two-step and all things. So I appreciate you guys shooting straight. Here's one. Here's one. Do we know yet whether this vaccine will fall into the category of and you get my point. I may be wrong with the example, but let's say, when children get a polio vaccine when they're kids, they get these vaccines in their kids, and pretty much they're covered for the rest of their life. Or is this going to be kind of like the flu, where we come back every year and get a booster or whatever they call it? Do we know that much yet? How far down the road can we look, or do we know yet? Dr. Abraham, what do you think?
Sure, great question. And I really appreciate, what you said. Dr. Boyd and I are here to answer people's questions, and we will share with you what we know and nothing more. We hope for the best, and we pray, and we want to end this pandemic, but we ain't going to lie to you, and we're going to tell you things that we don't know. We know what we know, and we know what we don't know, and that's really important. And there's still a lot of information we need to find out. That's why we're watching closely every day, this situation. In an ideal world, first and foremost, unlike the flu virus that evolved so fast that we need to do an annual flu vaccination event, as many of us have gotten the flu shot. It's required for us in healthcare to get a flu shot every year. The coronavirus doesn't evolve as fast, so it's not clear yet that we absolutely will need an annual. But as you know from tetanus or diphtheria, there are vaccines that we get every 3 years, or we get a booster in 10, or we check your levels. And if you don't have that hepatitis B protection, maybe I'll give you another hepatitis B booster. Those things are definitely in the realm of possibility. We can't tell you for certain that that's where we're going. Now, what we know is that we are studying how this vaccine works in 2 to 5 year olds. We're looking at 6 to 12 year olds. We're looking at 6 months to 2 years. These are all very different groups, and we are going to watch those studies closely and see follow the evidence, follow the science, see what the Food and Drug Administration finds out, what our CDC Advisory Committee on Immunization Practices discovers and recommends. And based on that, this may be one that's added to the schedule, and we're very mindful as a public health advocate, health policy and medicine advocate. We only want to recommend that which is helpful, that which saves lives. We don't want to do no harm. We don't want to do anything unnecessary or wasteful. So we're not going to make any recommendations, including my pediatrician colleagues who make these recommendations, the American Academy of Pediatricians and the CDC ACIP. They're going to make those recommendations. If it's added to the schedule of vaccines, the inoculations that we do on a regular basis, then that's what we'll do. And I know we're looking at technologies that may combine COVID-19 vaccines with the flu shot or others. We're looking, there are technologies as to whether this can be an intranasal spray, or like polio, are they oral drops at some point? So a lot of these are still in development. We don't have all the answers, but I'll tell you, we're going to watch closely. We're going to hold industry accountable. People first. This is not about pharmaceuticals or their companies or their profits. This really is about helping end disease, helping us live our longest lives, our highest quality lives, our best lives, and do those things that we love and do. And if this helps us do that, then that's the recommendation you're going to see us as physicians make.
Dr. Boyd, I want to come at it at a slightly different angle. We've got just a few minutes left. As I said, I traffic in a lot of diverse circles, and some of the circles that I traffic in, and it grieves me, have highly politicized this issue. They have highly politicized this issue. And one of the comments that I hear in certain parts of the country and certain parts of the population is that the numbers, the death numbers and the numbers, the statistics on COVID are highly inflated. I've heard radio programs, and I've heard conservative radio announcers and disc jockeys say, you know, the number is this, and less people died of you know, rabies, whatever it was. But they were saying they're highly inflated. What kind of reliability can we, who are trying to make decisions, place on the numbers, the statistics? If somebody dies, you know, in the hospital, and I've had a friend of mine that died of an issue that he had been dealing with for a long, long time. And I know we talk about the highly susceptible and those who've had previous diseases and stuff, but the family was not clear. The family was not clear on whether this guy died of that existing disease he'd had for whatever, or whether he died as COVID, and which statistic would he have been included in. Give us some insight on the validity of the statistics.
This is a great question, actually, and one that we have been working, we meaning scientists, clinicians, people who have been working on the COVID vaccines have been working on really closely over the last year or so to make sure that we can believe the data. So the data, first of all, in terms of like COVID vaccine equity, in terms of the rates of COVID vaccines that go to groups based on your racial and ethnic group, we have been working to make sure that states and localities actually report COVID cases, COVID hospitalizations, and COVID vaccine rates by race and ethnicity. So sometimes the data that you see that reports how many Black folks have had COVID cases or how many Black folks have died of COVID, it comes from the states that are reporting that data. In good places to get your data, and good places are the CDC's website or an organization called APM Research Lab. If you go to those places to get your data, they tell you exactly where they got their data from, the exact states that have reported and the states that haven't reported. That's really important because it allows us to then interpret that data. If your state isn't included in that number, then you might have to go to your local data to determine how specific the number is for you. For most of the data we have on vaccinations, we have reporting from 43 states or more. So we have pretty good data by race and ethnicity for vaccination rates by groups for most states. But again, that's not all states. But I want to kind of touch on this point about the idea that the data is kind of an overestimate or that people are overblowing what COVID has been. I think for our communities in particular, we don't have to see the data to know how devastating COVID has been, right? We know that most Black folks at this point, upwards of 70%, 7 out of 10 of us, know someone personally who's died of COVID. So for us, I say specifically for Black folks, we know this data is real because we've lived it. We've lived in neighborhoods where multiple people have died, where some families have lost multiple members. And so we know how devastating the pandemic can be. But there are also alternate information universes, especially when you get your information from unreliable sources online. So people have to be very careful about where you get your information. Again, the CDC, APM Research Lab, your local hospital, those are reliable sources to get information about the burden of COVID, or your local health department. Facebook is not a reliable source, despite what your friends may say on Facebook. YouTube sometimes is not a reliable source if you can't trace that source back to the organization that it came from. And so it's important that you get your information from a reliable source so that you know that it's true. And I just want to plug that Black doctors and I have made an entire rabbit hole of healthy information about the COVID vaccines on YouTube, and we partnered with YouTube so that you can get access to this information specifically online.
What's the
That
site?
is called The
site.
Conversation Between Us About Us, and it's at our website, www.betweenusaboutus.org, where we answer all of these questions, all of the myths that folks have heard, questions about infertility. No, it doesn't cause infertility. Microchips. No, there is no microchips in it. All those questions are on our website, and it's on YouTube because we are working to combat this disinformation that we know is targeting Black folks online. People are purposefully trying to make Black folks concerned and not have access to equal, positive, credible information about the COVID vaccine. And so there are folks like myself and Dr. Abraham who are working really hard to make sure that you guys have that access.
Okay, I'm gonna wrap. I got a long way to go and a short time to get there. Just a few more minutes. Here's what I want to do. I want to toss this one back to Dr. Boyd. I want to wrap up with the question of the hour that I'm going to share with Dr. Abraham, and he's going to take us home. All right, here we go. Dr. Boyd, number one, give us the name of that YouTube site again, number one. And then number two, this is a very, very important question. As a pediatrician, what is your advice concerning children taking the vaccine, and does it have any impact on their reproductive organs, on their ability to have kids down the road? How is it going to affect them down the road? Let's start with those two. The site on the YouTube, and then secondly, the idea about children and reproduction.
These are very important questions. Our website, you can find it by Googling The Conversation Between Us About Us, or you can go directly to our website, www.betweenusaboutus.org. And this question about children is really important. We have seen from the safety data, at least down to age 12, which is the data that Pfizer released for their recently approved vaccine for kids down to age 12, that there is no evidence that it affects children's reproduction. This is also true for women and girls. So there is no evidence that the COVID vaccines affect children's or women's reproductive health. It does not affect your ability to have babies. It does not cause infertility. And we have looked closely because early on, even in the clinical trial process, women became pregnant during that process. And so we were able to follow tens of thousands of women to be able to tell that they did not have their reproductive health affected by receiving the vaccine. So that's really critical. But I'll also say for Black families in particular, and for Latinx and Afro-Latinx Latinx families. It's critical that we understand that our children were the most affected by COVID. Black and Latinx children made up 75% of COVID deaths and 75% of the very rare COVID complication where you get the extra inflammation in your body and you have to go to the hospital. That's called MISC, M-I-S-C. So our children are disproportionately affected, which means our children need to be prioritized to receive the vaccine. So I know folks have heard that children just aren't as affected as adults and why they weren't as hard hit as the elderly and older age brackets. Children are absolutely affected. And among the children who are affected, it's our children who are hit the hardest. So it's really important that people understand that giving the COVID vaccine to our children can protect them from those severe COVID complications and from dying from COVID, which did happen. We estimate for about 300 to 600 kids over the last year.
Wow. Dr. Abraham, put on your Reverend hat again. Here's the question of the day. Here's the question. I'll set it up this way. Myself and two of my dearest friends in the world, certainly my dearest friends here in Los Angeles, Bishop Noel Jones and the City of Refuge, and my dear, dear friend who is the Bishop of the world, Bishop Charles Blake and the West Angeles Church. Our three churches are coming back into our buildings. We're planning right now to come back to our buildings on 4th of July, July 4th. Now, here's my question to you, because I have many of my white friends who've been going to church for the last several months. But now, they kind of do it with a different style, you know what I'm saying? And so they've been going with masks on, and they've been going and nobody's singing. What's it going to be like when black churches go back within the next, in California, June 15th is the next benchmark. How soon can we go back? And when we go back, do we have to still wear a mask? There's one guideline that says you can go, but you can't sing. Black folk can't go to church and not sing. You can go, but you got to have a mask. We can't talk to each other and we got nothing to say, so I'm just saying, give me your professional opinion as to what's it going to be like when black folk go back to church with all these restrictions, and put on your Reverend hat and talk to us. What saith thee, my brother?
Well, first I'll say I applaud every church that has taken an active role, including you and your congregation, to get vaccinated. First AME, Pasadena, Calvary Baptist, Greater Zion, Mount Zion, and this Saturday we're vaccinating at Southern Baptist. That's first and foremost. If you need a vaccination event on a Sunday when you're bringing people together, that's one of the best things you can do. Invite them back to church and get them vaccinated. So that's one. Two, we don't need to overkill, overdo, none of it. The research shows that a lot of that was theatrics, and that's a lot of motions and going through the motions. We need to be safe. You be safe. And I know that mask is uncomfortable and people don't want to be wearing the mask, but we still recommend wearing a mask. We still recommend distancing. We still recommend washing our hands, the basics. And then we want to make sure that people get vaccinated. And that's one of the privileges of getting vaccinated, is back to those missed memories, missed moments, including back to worship, collective worship, and back to singing, and back to being in the choir, back to preaching. That's why this vaccine is the shot of hope, that shot of faith, that shot of life that we desperately needed. So I do believe we're going to watch Dr. Fauci closely and see what the NIH and the CDC continues to say. They are continuing to make these recommendations for us to ease up those safety precautions. We don't need to do overkill. We don't need to wear bunny suits. We don't need to be spraying down our sanctuaries. That's not necessarily the right thing to do. But we should all remember, out of an act of love, out of an act of service, out of an act of caring for one another, we do things that help prevent anyone from getting COVID. And so if we can maintain and keep those basics going, we do ask if you can take some of this stuff outdoors, if we can move some of our activities to our parking lots and to those spaces, that's great. If we can kind of make sure we're spaced out in church, but we are going to get back to a place where we can preach, we can sing, we can talk, we can hug. Those things are important. That is a part of being human. That is a part of being people of faith. We have missed that. People have missed that. That has hurt us, and we can't afford to let that happen. And we must continue to prioritize our communities getting vaccinated. Latinx men died at 300% the rate of others. There are low rates of vaccination amongst Black and brown men. They don't deserve to die. We must let them know that we do this out of our burden of love. This is our cross to bear. And this is what, when we think of going to church, we think of all the miracles. These life-saving vaccines are the miracles that we desperately needed to live. So please take that shot of hope. If you need vaccines, you let us know. We will bring them to your church. You go back to church. Let's go back to community. Let's get it done. We're all in this together.
Let me just
Amen.
say, thanks to both of you. You have absolutely encouraged us. You've shot straight with us. Thank you for taking the time. Dr. Boyd, Dr. Abraham, thank you so much. You guys are on the front line. Stay on the front line. Stay on the wall. Thank you for all that you're doing. I just heard from CNN that nearly 80% of the people in America live within 5 miles of a COVID vaccine. Okay, that's a powerful statement, number one. Number two, more and more churches, I understand this coming Sunday, it's going to be at one of my sons at Southern Baptist Church. More and more churches are being involved. Our church has been doing it. Many other churches are being involved in it. Listen, my point is this. The issue is no longer that of accessibility, about availability and accessibility. It is about the willingness to trust God to heal you any way he wants to. I want to encourage you to be involved. Following this broadcast, we're going to share